So now that our actor has stepped out, I just wanted to find out from you, Barbara, how you thought that went. What did you think went well during that interaction?
I think it went, all right. I wouldn't say that it went maybe, spectacular. I was just trying to preview some information and lay out what kind of treatment options she would need it. But I was really trying to go step by step in what I was trying to explain to her.
Okay. Chris, what did you think that Barbara did well?
Yeah, I would agree with Barbara. I thought she kind of explained to the patient what was happening. She went step by step. I thought it was very clear. Yeah.
So, Michael, what did you think Barbara did well in that session?
Well, I'm not quite sure what she did well, but I know that she really completely blew it when it came to picking up the patient's cue about the radiation treatments. It was so obvious. I mean, I can't believe anyone could miss that.
We are trying to focus on things that she did well. And, I just want to remind the whole group that there's many different ways to communicate with patients. And people have different styles and beliefs about how to do that. And, situations, particularly in medicine, are not black and white. So it may be that that she recognized her questions and was going to get to that potentially later. And I think we need to keep an open mind about there might have been a very good reason for that. Barbara, can you give us a little bit of insight into what you were sort of thinking at that moment when the patient was asking about radiation? And
yeah, my intention was really not to ignore that cue. I heard her when she brought it up. I was just so focused on trying to complete my thought and making sure that she would understand completely what I was trying to say regarding the surgical procedure that she would need eventually. That I kind of opted to wait a little bit longer before addressing the radiation, but I can see how that maybe could have been interpreted as being dismissive, but that was not my intention at that point.
So, Michael, do you think there might be some reasons why you wouldn't necessarily respond immediately to a patient's cues, or can you give Barbara some suggestions of how you might deal with that situation if you're trying to sort of get through your agenda and they bring up a topic that you do want to get to later but aren't prepared to talk about right at the beginning?
Well, I guess so. I guess you could make note of it and then maybe address that and say we'll get to that later on. That might be a good suggestion.